Well, hello, Kathryn. How are you?
Aloha, Sarah. I'm doing very well. Thank you.
Great. Tell
Okay.
me a little bit about yourself.
Okay, well, I grew up in the Southern California beach cities and went to college in UC Santa Barbara. And that's where I discovered my career, which has been in hospice. I went knowing I wanted to serve and help people, but I thought I wanted to be a nurse. And I needed a volunteer project for a class. So hospice was just starting up. And
Oh, okay.
hospice was just brand new in the United States, and they were trying to figure out how to do hospice. So through that experience and through the opportunity of becoming a certified nursing assistant at Cottage Hospital, I learned that I really didn't want to be a nurse, but I wanted to be the social worker for hospice. So I was fortunate to find such a privilege to serve career so early on in my life. And I knew that I needed to get my master's to do hospice social work. And so I did at UC Berkeley. I did my internships in the San Francisco both years during the beginning of the AIDS crisis. Since then, I've been a licensed clinical social worker. I've had a private practice as well as worked in hospice. So after decades of work in San Francisco Bay Area, 3.5 years ago, we moved to Kailua Kona, Hawaii, and I am now the clinical director at Hospice of Kona.
And if you could just talk a little bit about your position there and what you do on a daily basis.
Okay, so as clinical director, I'm responsible for the whole staff that works with Hospice of Kona. So I oversee the nurses, the social worker, spiritual care provider, the certified nursing assistant that works out in the field in the homes, as well as the ones that work at our hospice house. And I'm the first person that someone talks to most of the time about Hospice of Kona and how to get on service. I talk to their physicians or at the hospital for referrals and describe what goes on. I assign our social workers to go out to meet with them, and then I assign the whole team once someone has been admitted. I also make sure that we're working within regulations and compliance with Medicare. Hospice program is primarily home-based, although we do go to care homes, which are our family homes here in Hawaii that take care of 3 to 5 patients in their home. And we all wear masks. Certainly we, depending on what the nurse needs to do while they're visiting, they put on more gear. We wear masks and gloves routinely though.
That's great. And then we had talked earlier in regards to masks. You actually made 2 masks for us, for Josh and I, and we love them. Actually, a profile picture.
Yeah.
So I was wondering if you could tell me a little bit about the community involvement and how they started making masks and that whole movement.
Actually, we have a strong volunteer program. We have over 200 volunteers for Hospice of Kona. Some are snowbirds, so they come and go back to Canada or the United States primarily during the winter. They come back, and one of the groups is a sewing circle. And every year they make a quilt for each camper that we have in our kids' camp for bereavement. So then, not knowing if we're going to be able to do camp or not this summer, they shifted to making the mask. And now we can provide masks for our staff and keep them safe, as well as other family members of our patients and, of course, visitors up at our hospice house. One of the sewers that is new to us, her daughter is an ICU nurse, and they figured out how to make a mask that can go over the N95 comfortably. So she made us 50 masks to
Wow.
so it was very sweet. People are, amazing, their generosity here. Yeah.
Thank you very much for that. That's really
Sure.
heartwarming. I know a
Yeah.
lot of my viewers will enjoy that. Perfect.
Yeah.
So has your work increased? I know that you are on call regularly. Because of the crisis, it seems that we are in desperate need of people like you, especially in the hospice industry. Can you tell me a little bit about how it's changed due to the crisis?
Sure. Well, since we are a 24-hour service, we always have a nurse on call to our patients. So families or the patient can call anytime, day or night. And I trade off weeks with our CEO in taking administrative calls. So I'm back up to the nurse. Originally in January, I started hearing about this virus, right? And your dad and I started watching more analysis of it. I ordered N95 masks, not knowing what would happen here, living on an island, very dependent on shipments. I didn't know if ports would close, if shipments would stop. So I remember introducing the idea to my team and starting the education, which was part of my job, about what is this virus, what do we know, what don't we know, which was a bigger discussion, of course. And they kind of giggled at me for ordering, these masks. But I did increase what I thought we might need over time, supply-wise. So I think February was kind of spent trying to figure that out. It's so hard to plan for something you don't know what you're going to need or how much and what would really happen here. Luckily, our government did take it quite seriously. They did shut down or they put strong restrictions on travelers. Travelers to the islands need to be quarantined 14 days once they arrive. And they are being monitored. We have a population of about 200,000 people. Today, we have had 81 cases of COVID-19 and 77 people have recovered. So there's 4 patients that are on self-quarantine at home. There was only 1 person of those 81s that needed to be hospitalized at our Kona Community Hospital. So it's really hasn't hit us like we anticipated it might. I still think there might be more to come. I anticipate a second wave once our travel restrictions are lifted, but we'll see. And we also are sharing what we have with others.
Great. I mean, it's so good to hear the positives. Sometimes when you hear the news, you don't really know where the numbers are coming from. And so from your perspective, that's really great to see, especially in Hawaii. Probably has to do with the fact that you guys are an island and you have a little bit more control over who gets in and who gets out, that everybody's wearing masks and the proper precautions are put in place.
Mm-hmm. Mm-hmm. Yeah, most everybody does wear a mask nowadays. And of course, they're required to go into any grocery store. Things are just starting to open up a little bit here in terms of other types of shopping. You said in terms of our low numbers, in terms of diagnosis, our work has been impacted nonetheless. We have patients who had anticipated staying here in Kona until they were almost too weak to fly to their daughters or sons on the mainland to be cared for and to pass there. So there's a lot of heartache and loneliness with that. Same with anticipating family members coming in the last month or so of their lives. And so our nurses and our social workers and spiritual care, of course, have needed to listen more, support more, do more, because we don't have the extended family for the most part for people. Now, there are a lot of people that do have big families who are working, but this is something we've noticed. And it's a little more stress on my staff. Yeah.
Sure. It seems to be exhausting for a lot of people in the medical profession. I do know that there's some great stories of the community chipping in and helping, whether it be just providing a hot meal or, you know, doing something for their families when they're having to go out and be those first responders in this crisis. So it's really great to hear your story and their story and what you guys are doing. Whenever we talk, I always say, you know, how's it going on the front lines? And it's really true. You know, you've been toughing through it this whole time, and we're really appreciative to hear your story.
Oh, well, thank you. Thank you. It's really something to witness my staff being so courageous, you know, during that period where we really didn't know, and there's still a lot we don't know if you're being exposed or not, but still being such dedicated workers for hospice to really help people stay at home and have the care they need, the quality they need. It's been a real honor to witness.
You guys still separated through all of this? Or no, you guys stopped that.
Once the numbers came in that people weren't dying from it, like at first it was thought it would be very high here. We didn't, but I do come home. I do clean my shoes outside. I do go straight and change my clothes, put my clothes in a separate hamper. I, you know, wash my hands, of course, before joining in conversation with your dad. And we share a car, so I wipe it down, clean it after I've used it, and anticipation of trying to protect him. Since he works at home, he really has the privilege of continuing his work and not having to be exposed. So I was kind of the gopher for grocery shopping and any other needs we might have. So online shopping has helped too with that. But fortunate to have a 2-story home. And so to decrease his fear of me exposing him to something that he might not have been exposed to, I did live upstairs for a while. There's a great loft opening, so we had a lot of communication nonetheless. But it was just to help him be comfortable and to wait it out and see what happens with the numbers. And luckily, I've had great health. We have increased some of the supplements that we take to prevent it, or at least lessen it if we were to get it.
To boost the immune system, such as zinc, right? Multivitamins.
Zinc, vitamin D, multivitamins, yeah.
Well, great advice. I do the same now.
Good.
This is awesome.